Good evening and welcome. This is Dr. Keley John Booth. I'm going to go ahead and cross over here and get started this evening. So welcome. And we're here in Oklahoma City at the Orthobiogen offices in Oklahoma City. So wanted to welcome you. For those of you that are tuning in this evening, thank you for taking time out of your busy evening. And I wanted to let you know that basically today we're going to try to take this in a manner and have this webinar really be informational and help answer some questions. I hope that will get you sorted in understanding how and why Regenexx and here at Orthobiogen we can provide you with some surgical alternatives. So with that, I'm going to go ahead and get you switched over here to the presentation. And we're going to go ahead and get started. So, all right. So Oklahoma's most advanced knee surgery alternative is what we do here at Orthobiogen. And basically, we're very excited to be able to provide these kinds of services and treatments to Oklahomans. This is something that has really been a multi-year effort to bring the state-of-the-art orthobiologic treatments really by the industry leader affiliate network at Regenexx. And we're excited to be able to offer this and excited to share with you information this evening about what we're doing. So here I'm going to go a little picture in picture here. And then, all right, so let's see here. Sorry, I crossed over there. And so basically, let's move on. So a little bit about me. My name is Keley John Booth. I am an interventional spine and joint specialist here in Oklahoma, and I'm a native Oklahoman, trained at University of Oklahoma. I'm a board certified anesthesiologist. A lot of people don't realize that actually the specialty of interventional pain management was essentially started and fostered by anesthesiologists as a need was sought, as the need came up for really getting into very specific areas and doing very precise injections for patients to try to help alleviate initially spine pain, and that grew into other areas. And ultimately, we span the entire body now with these techniques. And we work a lot with our colleagues that are physical medicine specialists as well. And as far as my background, I am basically a 20-year veteran now, I can say. So I've been a physician training and experienced in treatment of spine and joint therapies, ultrasound guidance, x-ray guided treatments of chronic and acute pain for degenerative conditions as well as acute injuries for some time. So I've learned a couple of things over the years, and I look forward to the opportunity to help you figure out what may be causing your knee pain and your particular issues, that we may be able to help you avoid surgery and consider Regenexx as an alternative that I think many of you will find fascinating, that we're where the state of the technology is, and we'll kind of go into some of that here. All right, so moving on. So why you're here? Many of you are suffering from pain. You may be having a lot of downtime. You want to do things after you get off of work. You want to get out there and be active on the weekends, whether it may be hiking, cycling, whatever your chosen activity is, and you're having a lot of downtime secondary to pain and discomfort. Well, you're in the right place. We're going to learn about some opportunities to help you with your specifically knee pain, but we can answer other questions if those come up as well. And in this series of webinars that we do, approximately every month, we have a different area that we are focusing on to try to really get down into the specifics to help patients. So, and of course, you want to avoid surgery, which I don't know if I've ever met a patient who said that I want to have surgery if there was an alternative. So that's kind of a no-brainer there. And many times we get people seeking us out, obviously, for that. And perhaps you've been told that you're not a surgical candidate, but you continue to have pain. But the concern is that you do know that there's something wrong and you need to get that addressed, and you've just kind of been languishing. Maybe you've been getting repeat joint injections. that's something that we get commonly as well. So, and you want to seek out all your options. I think that makes sense before you make a decision. And, you know, and you're not ready to slow down. And as we all do, you want more out of your life. You want to be able to do more, live longer, and have a better general quality of life. So, all right. So what are the obstacles, right, that get in that, to get in the way of that? So, you know, of course, the cost, time, there's a lot of confusion about what is regenerative, what is interventional orthopedics, what are stem cells, for example, and that's a very common area of confusion, and I answer a lot of questions about that as a specialist in this area. And then, you know, all of that kind of culminates in the fear that you may have dealing with the pain that you're suffering and not being sure about what to do next. And then, of course, you want to, you know, develop trust in your provider and really believe that they have your best interests at heart. And that's something that I have the great privilege of being able to develop relationships with my patients. And really, you know, it's often said, but I really think it's important to take it to heart that, you know, that relationship that you have with a patient and treating a patient as if they were your own family member, or even imagine yourself in their shoes, because you very well may be one day, and you want to be able to understand what their fears and concerns are. So, all right. So all the issues that you're considering there. So relative to, you know, Regenexx, where basically Regenexx was the first provider network really to perform regenerative treatments and spinal injection therapies in the United States in regards to, for example, using quote unquote stem cells to treat the spine. And that's quite a milestone. That was all the way back in 2005. So one of the first in North America to do that and document it and publish the information behind that. So that's really just to give you an idea of how long the history goes back for Regenexx. We also have the Regenexx Networks has the distinguished you know, characteristic of being the network that has done more treatments than any other network and published much of the research that is out there. Many of the doctors that are actually actively engaged in performing Regenexx therapies are actually not just practicing physicians, but they're active researchers and developing new techniques, technologies, tracking patients, and really developing the field of interventional orthopedics. And of course, with a mindset to how do we make this as safe as possible for patients? So in terms of how we're doing that, you know, we have large databases tracking tens of thousands of patients over many years that allows us to track the safety and both the outcomes and helps us refine the procedures over time. So we have one of the largest databases currently in existence for tracking regenerative procedures. So that's pretty exciting. And of course, all the patients benefit from that over time. So, all right. So moving on. All right. So, you know, so that tells you a little bit about why Regenexx. And there's some key points too that I think are worth mentioning here. Celebrating more than 17 years as the leader of interventional orthopedics in the United States, and really coined that term and really have popularized that as a way to help people understand what it is that we do as regenerative physicians as part of the Regenexx network. So, and we estimate currently we're over 150,000, but we've tracked over 140,000 different procedures performed to date across the network, which is pretty impressive. We currently have over 600 employers providing Regenexx as a benefit to their employees. So that's pretty exciting. So we are seeing these techniques start to get out there to the masses. And currently, at last count, approximately 7 million covered lives nationally have access to Regenexx as a benefit, and hopefully coming to more and more employers in hopefully your neighborhood. So, all right. And then moving on to, you know, what our goals are this evening. we want to help you identify alternatives to traditional orthopedic surgery, really discover if you're a candidate, because of course, one of the key points with any medical therapy is there is a failure rate, there is a success rate, and you have to understand what the likelihood of success is for your condition. And that's one of the things that I think really is underappreciated about Regenexx as a network of physicians, is that the integrity of the providers and the honesty of really talking to patients and saying, look, if you have a very severe condition that is not likely to have the potential for significant improvement, we're not going to recommend moving forward. And we very well may confirm that surgery might be a good option for you. And I think that honesty is critical, because we don't often see that in all the clinics and other clinics that are out there. With Regenexx, it is something that happens, almost weekly. I have to tell a patient, I don't think that this is something that may be right for you based on your specific condition. And that's important. Also, we want to help you this evening figure out how to get scheduled for a new patient evaluation and get more of your questions answered. And I'd like to personally extend an invitation to spend time with me and perform a workup and an evaluation physical exam to see if you may be a candidate for this. And I think that's really a critical step that you've got to go through. Every patient that has a Regenexx procedure does go through a very specific set of interactions that allow us to really determine your candidacy, depending on what your symptoms and diagnosis are. So, all right. So I'm going to jump into here also share with you a little story about a patient that I treated not long ago that was a medical professional veterinarian, and was having some challenges keeping up with the day-to-day workload. When I had a chance to meet this individual, they had gotten to the point where the arthritis was ultimately found to be pretty significant. And so there was some moderate severity to that. So meaning that there were some changes in the cartilage that were significant in this medial compartment that many times people will hear about, basically the inside of the knee. And the patient also was suffering from some meniscus damage, which I'll show you some information about here in just a little bit, and kind of show you one of the unique ways that we're able to find that and look at that here in the clinic. And this particular individual works with race horses and equine athletes, so in an effort to make sure that they stay healthy. So really coming to me with quite a foundation of knowledge medically, and he was currently using non-surgical treatments to treat his patients, and it was very experienced with this and had been doing it for years and quite knowledgeable about the potential benefits. And so we had some very interesting discussions, and I found it's really nice to be able to see what others are using outside in other fields. And so but quite knowledgeable about these things. And so and also utilizing these techniques, the injection-based therapies, even for these athletes, in some cases very talented horses with histories of winning major races, and those are pretty exciting things to be working on. So he wanted to stay in the game, and his thought process was, well, look, surgery, he understood the implications of that. He has performed many surgeries in his career, and for him just wasn't an option. For one, he was just too busy, and the time that it would take simply to recover was going to put him out of commission in a manner that would really stall his ability to treat patients. And that was going to be a big deal if he was to consider knee replacement. So with all that demanding physical activity and then the lack of time for recovery, he really wanted to seek his other options. And so ultimately, we came up with a treatment plan, reviewed things for him in a way to allow an opportunity to avoid surgery. And it turned out that he was a candidate for treatment. And we ultimately performed a Regenexx, what we call an SD or same day procedure. And that allowed him to get back out there and get back on track, so to speak. And so it was a pleasure working with a fellow medical professional and watching him move through the phases of recovery in mere days compared to the weeks and months that it takes relative to, his basically what he would have done if he went the traditional surgical route. And he certainly was a candidate for knee replacement, and that would have just not been compatible with his lifestyle. So, as evidence of how well he was doing, he actually invited me out to the track, and I actually got a chance to get out there and kind of learn from him, and did some scanning, some ultrasound diagnostics there. You can see that's me in the stall with one of the elite horses that he was working with, and always learning. That's something that we do here. And so, and you never know, we sometimes get to go outside of our species and learn more about what's going on. So that was a blast. And that image was approximately 3 weeks after he had treatment. And I can tell you, he wore me out, walking me all over the area there, showing me all the things that they do behind the scenes with these really beautiful animals. So I really appreciated the opportunity to do that. So, all right. So relative to our time now, I wanted to kind of open it up now that you kind of have at least, hopefully I whet your appetite for maybe some questions, some things that we could look at for patients individually and figure out, do you have conditions that any of that sound familiar to you? And so is that something that, we could basically get into? So, and apologize for a second. I'm working through getting my chat questions up. And so we're going to do that here any second. Let's see here. So I'm scrolling through. All right. So one question is how do you know, what treatment to provide? And there's some questions about whether or not bone marrow or stem cells or PRP is the indicated treatment. So when we look at bone marrow versus PRP versus stem cells, it's important to understand that cell-based treatment, which would be bone marrow, that is actually live cells that come from you as an individual patient. So we literally take those cells from the bone marrow and we concentrate and prepare those in a specific manner depending on the tissue that we're treating. So the idea there is to actually come in and prep that. And when we use those cells, we're typically treating more advanced disease, patients with moderate to moderately severe osteoarthritis, or if there's tears or ruptures in the tissue, and we need to kind of fill those gaps, and we need the advantage of those cells. Now, stem cells are a component of bone marrow, but it's not all stem cells. And I think it's important to make that distinction because many people don't understand the difference between bone marrow, but there's a lot of other growth factors and things contained within the bone marrow that help us with healing processes that can help improve the tissue. And I think that's important. And for us, as a Regenexx clinic, we're commonly faced with, okay, which side of that fence are we landing on? And really, when you talk about knees, in my experience, it just varies with what you have coming in, and if you've got inflammation and some of those things, as opposed to large changes in the joint and potentially some bone changes, which I'll try to demonstrate here just in a little bit on an MRI. That's the big difference there, is just the severity of disease. So as that disease gets more severe, you will typically see us use bone marrow, which does contain stem cells, and actually use that for the treatment. And then PRP is more platelets and stands for platelet-rich plasma. So we do a blood draw to obtain PRP, of course, from the patient directly, and then the bone marrow comes from bone marrow aspiration that's performed typically under sedation in our clinics. We do provide that as a service, and most patients, hear bone marrow and they think, oh wow, that sounds like it might be uncomfortable. I've heard stories. Well, I'll tell you, in our experience, it's really almost a non-issue. It doesn't typically even come up after we do the bone marrow aspiration. We really fine-tune that to be quite a pleasant process. So, all right. So relative to, all right. So what are the risks of these procedures is another question that we got. So when we look at risks relative to, in general, anytime you go through the skin, you're going to have bleeding, infection as a potential. In my career, I've been fortunate enough to have no one have that problem, despite performing literally thousands of injections. In terms of chronic complications, and occasionally you'll have patients that may have been on anticoagulant or something like that, and they'll have a little bit extra bleeding and you'll need a dressing change or something like that. But we have a stellar track record here locally, and I know our network is quite interested in following any complications that occur. So we track all those things as part of our registry and our database, and the complications are actually quite rare. And so, in my personal experience, again, we have had minimal, issues. And the number one complication is a little pain at the treatment site. And depending on where it's at, with knees, typically extremely well tolerated in terms of overall, and especially when you compare that to a surgical option, there's really just no comparison in how much more quickly a patient returns to their normal activity. So yeah, so hopefully that answered the question. If there's anything more specific, I'd love to answer that. So I'm going to go ahead and move on with the rest of the talk here, and talk a little bit more about, we've touched on this already, but what is Regenexx? Regenexx is an orthopedic surgery and pain treatment alternative. And really, it's an alternative to what? It's really alternative to that traditional approach for orthopedics, which frankly has not changed significantly in many decades. If you looked back 30 years and you saw someone doing a knee replacement, while the tools that they're using may have morphed and changed shape somewhat, a lot of it is actually quite similar. You've seen some of these new things that they advent, where they've got robot assisted and those things, and unfortunately that just hasn't dramatically changed the trajectory of the surgical outcomes enough to justify certainly the expense. I've been on hospital committees where we have to put the funds together to fund these robot systems that are out there, and they cost millions of dollars and hundreds of thousands of dollars just to maintain them annually. And so, we unfortunately, sometimes we feel like sometimes we're trying to find, the guys are trying to find a use for the robot just to justify the money that was spent on it, but it hasn't really dramatically changed the trajectory at this point. Does seem to be more of a marketing thing than anything. So I would say, really still, even with those techniques, things have not dramatically changed. And that's coming from someone who's been in literally hundreds of knee replacements over the years, as well as other types of knee surgeries. If I include all knee surgeries, I've been involved in thousands of knee surgeries when I used to supervise departments for hospitals in the perioperative area and the Department of Anesthesia and Pain Management. So interventional orthopedics is really another key phrase here that I want to explain. Interventional orthopedics, think of this as, I think in a way that you could understand it is, what a cardiothoracic surgeon does with bypass surgery versus what a cardiologist does in order to place a stent. I think there's a lot of similarities, and they're very analogous in terms of the relative invasiveness, and and even when you look at outcomes, you can get a lot of benefit, of course, from having a stent versus a bypass. Now, sometimes a stent is not adequate, and you do need to undergo a bypass surgery. But as it turns out, the overwhelming majority of people actually do quite well just with cardiology care and less invasive options. And so my mother literally last week had a couple of coronary stents placed, and didn't have to undergo a bypass surgery, which frankly just would have not been an option for her based on other things that she has to deal with in her day-to-day activity and health overall. So cardiology is great for that. And that's kind of the analogous thing between an orthopedic traditional surgical approach and interventional orthopedics. So all right, so then also orthobiologics, that's a phrase that you'll hear us talk about a lot. That is essentially the medication that is being made from your own tissue and your blood and your bone marrow. And that helps us essentially explain that general concept. So when we say orthobiologics, we're actually including bone marrow. We're including, of course, that contains stem cells, so cell-based therapies. We're including in that the platelet-rich plasma. We also make other lab-prepared orthobiologics, including platelet lysate. That's something that you may hear us talk about depending on what procedure we're doing. So these are just generally how we refer to the medication that we make from your own tissue. All right, so and then and it's advanced regenerative medicine. So really, many people use bedside centrifuges, where you basically take a blood sample, you put it in the machine, you push a button, and then ultimately you get the product back, and then it gets injected. In the case of Regenexx, we actually have advanced flexible lab platforms, and we're able to basically prepare tissue in very unique ways that you just simply can't do with a basic bedside centrifuge or machine. So you have to have specially trained technicians, special protocols for how you handle those things. We have microscopic cell counting. We have specialized equipment to actually measure the content and the concentration of your platelets in your blood. All of those things get factored into it. So that's why we say it's advanced. So in terms of that, so relative to trusted alternatives to orthopedic surgery, really, there's probably no other group of physicians nationally that have done more to really provide a true viable alternative, and not just viable, but really changing the dynamics and the landscape of what is available for patients that don't want to have surgery. So that gives you a little bit of background for Regenexx. So, all right. So, traditional care, what does that look like? We've all seen that. I think, certainly if you're tuning in tonight and you've got knee pain, you've been through this. Prescription medications, and of course, even before that, over-the-counter medications that are not risk-free. And so, there's quite a few side effects that you can have from the anti-inflammatory medications. Some of them, some of you may recognize the term NSAIDs, or non-steroidal anti-inflammatory drugs is what that stands for. And that group of medications can lead to ulcerations in the stomach. You can have kidney issues. There's lots of side effects that can occur, and we have to be cautious with those things. And I think sometimes, people don't find out until it's too late. And so pretty potentially significant risk in terms of what happens if you overtake those in particular. So, and then, of course, there's blind steroid injection therapy, which really is still, unfortunately, the norm. So out there. So, and you may have seen this as the doctor comes in, or maybe one of their assistants, and they just put the needle in and just kind of feel around on the knee and shoot it in. If you do that repeatedly, the data is out there that does show, in fact, that repeat use of steroids in as little as 2 years with too frequent, dosing, and you can actually reduce the amount of cartilage in the joint, which then doesn't decrease the likelihood of surgery, but actually increases it, because now you're going to actually have worsening cartilage in the knee, which is going to potentially cause a lot more issues. And then you may get to the point where, and that's not the time to consider a regenerative treatment after you've had years and years of blind steroid treatments. You want to try to seek out that non-steroidal therapy earlier in your care, because the likelihood is that you'll get a better outcome if you can get to that before you have the potential negative effects of steroids. So, and then of course, knee arthroscopy or knee scopes, that is an area of concern as well, because of what's called meniscectomy, which is essentially shaving out a portion of the meniscus. And so, I'm right here, I'd like to bring in one of our models that allows me to actually show, and here, give me just a moment. I'm going to switch that over and basically show what we have here in terms of the meniscus. So this is a term that many of you hear about and don't often get a chance to really understand. And what this is a three-dimensional model of a knee. And I'm looking from the outside here at the right knee, and I'm going to rotate that around for those of you that to be able to see that. And relative to, let's see, I'm going to show that. So kind of get my head out of there so you can see the whole joint. All right. So right in here, you've got the meniscus, and this is the medial component. So you can see that, and I'm going to go ahead and isolate that so that you can really see how that sits between the bones. And so you can see, let's see here, it doesn't want to fly apart for me, but that's all right. So I'm going to go back, and then I can actually fade out the others. And so you can see through. And there you can see that medial meniscus in the shape of a C. And then, so we hid those, and then we're going to fade the others, and you can kind of see through that bone. You can really, now we're looking down through the leg bones, and you can see how that sits inside. Okay. So that's super helpful to get an idea of what that's doing. Now you could understand if I came in here and actually cut that tissue out, that's going to be a potential problem, because these bones are going to start hitting one another, and that's going to create some secondary issues. And this bone will begin to react, and that's where you'll start getting bone spurs out here. And so very often we'll see this bone kind of flare out. And this is that medial side, which is the most common area that we see degenerative disease. And this bone down here and this bone up here. So this is the femur, the leg bone that's closest, kind of connects into the top of the knee. And then this is the bottom, and you can see how that interfaces. So hopefully that helps you kind of get an idea of what we're talking about there. And basically, we're going to cross back over. And so, and unfortunately, the knee scopes where they take that meniscus out increases the chances that you're going to need a knee replacement. And it's directly proportional to how much of the meniscus gets cut out. And we've got 20-year-old data that does show us that taking out the meniscus is probably not a good idea, and does cause some of its own issues. And there's no real evidence that it even helps. So unfortunately, that's still happening all over the United States today. All right. So, and this is kind of a rundown that of many different procedures that are done in orthopedics, and it helps you understand that surgery is far from a certainty. It's estimated that 53% of surgeries have been shown to be ineffective in clinical trials. That's shocking. So, and that's why sometimes patients will tease and say, well, doc, that's why we call it the practice of medicine still, right? Well, but when it comes to surgery, I think we have to be a little more discerning and therefore try some other options that may be lower risk for you. And that's really at the heart of Regenexx is trying to do things that are less invasive, with less risk, with as good or hopefully better outcomes. And that's what we strive to do. So, all right. So, and I'll kind of go through these. And so ineffective risks and doesn't always work, which is problematic. And that's the big one there at the bottom. You can't undo it. Once you've had a knee replacement, that's it. And, unfortunately, there's not a lot I can do for your knee after that. All right. So moving on here, this is where I was talking about the meniscus and how it's very concerning that, a lot of these patients are having their meniscus cut out. And this is a journal, well-respected, the British Medical Journal here, and published a report about how, it's a questionable practice without evidence of even moderate quality. That's pretty strong terms for physicians. And unfortunately, this procedure, it was probably done, today in Oklahoma alone, it may have been done dozens and dozens of times just today, maybe 100 or more, because it's that common. All right, so the Regenexx difference, I think this is another important point to understand is, I always say, look, it's really apples and oranges when you look at Regenexx, not just compared to traditional orthopedics, but even when you go back and you say, hey, what about other regenerative alternatives? Regenexx, I can tell you from having researched it for years before I became interested in becoming a Regenexx physician, it's a shocking level of difference. So there's a lot of pretenders out there that say, hey, they do regenerative care, but unfortunately, it's often done really, it's impossible to compare what is being done out there compared to what takes place in a Regenexx clinic. And there's several reasons for that. So we'll go through, some of these. So, treating structures and being very specific relative to joints, intra-articular treatments, but not stopping there, but actually going into the ligaments. Those are those support structures that you have all around the joint that are critical for stability. And then we have, tendon health. And what are the tendons doing? Those are also very, very critical, and really the means that the power from the muscles gets transferred to the bone, through those tendon connections at the bone. So, and then of course we talked and looked at the meniscus. And again, this is just scratching the surface, because we also get into bone treatment as well. Bone health is critical, and Regenexx, one of our key things that we do is we actually treat the bone in the areas where you have significant arthritis, and we actually support that. And studies, many studies have shown that if we can help that bone, we can also help that cartilage. So that's really currently the state of the art is for more advanced arthritis is to treat the bone underneath the cartilage, and we do that routinely here at Regenexx Clinic. So, all right. So also, one of the things that I like to point out to patients is the diagnostic differences in how we look at things. This is actually just an image I just pulled off of our ultrasound diagnostic system for I did a assessment for a patient to show them, they were told that they had bone on bone, which is one of my least favorite terms, because that implies maybe that you don't have any cartilage left, right? So, well, here on this side of the image, you can actually see this black area. This is actually cartilage along your leg bone, the one that comes in, the femur that comes in from the top of that knee, really forms the top of the knee there. And right over here, you should see this black area extend over the bone, but it does not. You actually see it really thin out, and there is some cartilage still there, but in this bone looks a little rough here around the edges, so to speak. So you can see that in that picture. And I have another image here from the same patient, and this is actually showing extra fluid that literally is building up. So all of this fluid through here, this black area, is inflammatory fluid that's kind of gotten in there. And that's what patients will come in, and maybe you've experienced this personally. You'll actually feel that knee almost feels full and stiff. And sometimes you'll look down at it and you can actually see that it's swollen. And sometimes we'll even feel warm So patients will sometimes comment, on that. And so this helps us, helps you understand the value of this diagnostic tool. And this is also not only how we can diagnose more specifically, we can actually come in here and use these techniques and this imaging technique that is radiation free to actually access that and start to treat that joint and aspirate that if we need to, or draw that fluid off, is what that means. So, but yeah, so that gives you an idea. And then here's an actual video talking about a meniscus. You can actually see here, I'm going to click this and let that play. Now, this is a stress exam of a meniscus. And right here, you can actually see the meniscus squeezing out from between the bones. And I'll play that again so that you can actually see that right through here. You can actually follow that, and you can see that almost looks like toothpaste coming out from between if you were just to squeeze that. And so again, bone here. And by the way, this is actually, bone spurs forming here on the edge of the bone, because these bones are routinely, daily, banging into each other. And that creates the stress inside the bone that then can make it more difficult for the bone to take care of the cartilage, which then makes the arthritis worse because, again, you no longer have this padding. And patients with this type of a picture very often have had a good portion of this meniscus from down in here actually shaved out by a surgeon. And you can see how that would create a bigger issue. So I'll play that one last time and just show you so you can see what's going on there and see it kind of coming back down in there. And then when I push that together, you can see the meniscus go out. So kind of interesting how that works. All right. So, and then let's see if it'll let me go to the next. All right. So, and here's an MRI, and I'm kind of giving you, I apologize, I'll snap back there, but I'm kind of giving you an idea here of the level and the specificity with which we diagnose patients. And we look into all of these things. So if you walk into a clinic and they say, hey, yeah, I looked at your x-ray and, you need surgery, or you want to do a regenerative treatment, it'd be nice to know more specifically what's going on. And some clinics simply don't do that because it doesn't matter. If the question is, hey, am I going to do surgery or not do surgery? Maybe it doesn't matter to look at all these other pieces because they're going to cut this portion of the bone out. They're going to cut the bone out from here and here. It's going to be gone and it's no longer there. So that's a different thought process. But if you're going to do regenerative, you really have to get in here and understand the pathology. And again, this is joint fluid, this big white area, which we saw just on an ultrasound. Now we're looking at an MRI. And down in here, we're actually seeing the meniscus, which is damaged here. And so here is a much better conditioned meniscus here. There's a little bit issue out here on the lateral side, but you can see that little black area. And then over here, you can see these two bones are coming into contact, and you can see this bright signal down in the bone. And then here you actually even have a little bone cyst here. So that is just that been getting beat up, and that meniscus is not doing much, and there's really not much left of it here. So that is gives you an idea of the level that we go to. And this is, again, just one picture of about 150 pictures in the MRI that we will go through with each patient individually. And I'll spend 45 minutes to an hour, sometimes more, in the room discussing all these findings, what the treatment options are, what to expect. And so that's something that a lot of the Regenexx physicians really make sure that we educate our patients about what we're doing it and why we're doing it. And so, and really help educate you, even if you're just a surgical candidate, because we don't think you're going to get much benefit. I want you to understand why. And so that's important. All right. So, so let me go ahead and, so Regenexx, again, the difference is, completely unique scientific approach. I think, when we compare that to anyone else doing regenerative, really the highest level of regenerative out there, in my opinion as a physician. And I looked before, again, years ago when I joined the network and started the training process, and I personally trained over 2 years before I actually did my first procedure. So, and then we also have our flexible lab platform, which is key to our outcomes. So we treat the medication the orthobiologics that we talked about earlier as a prescribed and dosed medication that comes from your own tissue to help treat you. And so that is a critical piece of this. So, so we really look at this in a very scientific way. We really try to get you the best outcome that we can using these techniques. So, all right. And who can benefit? You know, people want to avoid surgery, of course. So we've gone over and over that. And we maintain natural anatomy and physiology. We try to really help patients, you know, get essentially the best out of their native and natural tissue. So those of you that are interested in maintaining a holistic, you know, approach to your health, that fits right along with that. And then we don't have time for, you know, downtime and lengthy rehab. That's really a key one. And then those who don't want to, you know, be perpetually on prescription medications, you know, this is a good option to consider as well, because again, from the improvements that we have, we do have patients that improve and are able to decrease or come off of prescription medications such as anti-inflammatories, and sometimes even if they're on a pain medication, that can help. So previously failed knee surgery, you know, patients that have had knee replacement and ultimately said, you know what, I'm not ready to go through that again. And in some cases, I had a patient literally within the last week that I was treating their knee in advance of a knee replacement because one of their knees was so damaged that I didn't really feel like that they were a candidate based on what we were seeing diagnostically. However, their right knee was in really rough shape, but their left knee was also in pretty bad shape. And we went through the whole diagnostic and we said, look, I don't know how well you're going to do with recovery from your surgery on the right knee if your left knee is in the condition that it's in. So we actually went ahead and started treating the left knee to get it doing well so that they could actually tolerate a knee replacement and go through the necessary recovery of surgery. So that's kind of a unique case as well, where we go in and try to help the patient get the best and also factor in all the conditions that they have. All right. So, and people that have concerns about the risks of surgery, I run the numbers on the relative mortality risk or the rate of death per event. Believe it or not, skydiving, scuba diving, and hang gliding are all a lower risk of dying, unfortunately, than having a major surgery. And so a lot of people don't realize that, but that's I actually ran the numbers recently on that, and I was so shocked to find that out. And so, yeah, you're looking at one in many hundreds will potentially, have a problem. And part of that is the age at which we get knee surgery and those things. But it's important to look at that, that technically, you're at less risk skydiving or scuba diving or hang gliding than you are going into an operating room for a total joint replacement. So that is interesting. All right. So medical contraindications for surgery. Some patients just simply can't stand the stress of having a major surgery. And so we do get patients that request for us to go and look at what limited, footprint we can have and reduce the risk, because of course, our procedures are performed under sedation rather than general anesthesia. All right. So, and then some patients are just too young for knee replacement and they want to extend their benefit. So, all right. So we're going to move into a couple of questions here. So let's see here. Give me just a second. I'm reading the questions, and it says, are there any dietary recommendations when preparing for these procedures? So that's a great question. And one of the things that we, typically will do is place patients on a supplement. And Regenexx actually has thought of this many years back and actually went out and had a formulation made specifically that has been shown, the ingredients have been shown to support stem cells. And so that is something that we provide all of our patients when they have a bone marrow procedure. And for some of the patients that have even platelet-based treatments, we'll actually go in and go ahead and do that. So relative to our the recommendations there, we help along with that and basically provide that. So, and typically people say, well, when should I start it? I want you to start it as soon as you can, because the longer your nutrition is improved, then we'll see a lot better benefit, down the road when we go to draw the cells or perform the procedure. So, and most typically we'll go ahead and if we're planning treatment within the next 4 weeks, and we'll go ahead and start it as soon as 4 weeks before, and then also maintain that nutritional support typically at least a month out. And I do have patients that just take the nutritional supplements for many months after, because they generally like the quality of the supplements. So they're very high quality, and they've been tested and formulated specifically to help with these conditions. And we have some studies that are that are in the works right now with Regenexx that is going to hopefully be published in the not too distant future regarding that. And so, and of course, that'll all become available, and we'll share that information. But it's hard to find rigorous studies for that. But I can tell you anecdotally, when I have patients take the stem cell support formula from Regenexx, their bone marrow is typically of higher quality, and we get higher cell counts than what we do when we don't use it in kind of age-matched patients. And that's why they're doing that study, to really bear out what is the value and what the percent improvement is. And so I'm excited to see that, but we know inherently we just include it because it is, we do see the benefit. So, all right. So other questions here, let me see. So do I need to be referred by my primary care doctor in order to have an appointment? Absolutely not. And matter of fact, that is, for us, sometimes the primary care doctors don't really know enough about regenerative. They haven't been exposed to that, because this is not something that I can tell you is taught in the overwhelming majority of medical schools, in the world, much less the United States. So you really have to go out and seek this knowledge and become an expert, through your many times your own hard work. So, but the idea that your primary care doctor would have to refer you is just not the case. And matter of fact, we routinely have patients self-refer, and I would say 99% of patients are not coming from their primary care doctor typically. And I think that makes a lot of sense when you're just trying to get all the information. And also understand that your primary care doctor may be prohibited from sending you out of his network. For example, if they work for one of the major hospital systems, a lot of people don't realize this, that they actually can be reprimanded for sending patients to a specialist outside of their hospital system, which seems like a conflict of interest, but it happens. I can tell you for a fact all of the time that's an issue. And so if the major hospital system, which I am unaware of any major hospital system that offers anything like what Regenexx provides, they all offer knee replacement surgeries, but they don't offer regenerative. It's kind of difficult for your doctor to send you to someone when they don't have anyone. And so very often it's left to, and I do get, however, subspecialists will often refer patients to us. And that includes everything from physical therapists to chiropractors to orthopedic surgeons, because they know the level of work that we do here at Orthobiogen with the Regenexx treatments. So, all right. So I'm going to check this other question we have here. All right. So can you regrow cartilage? Okay. So this is something that is a tough question, because some patients appear to have a significant improvement in the function of their cartilage. But then when we go and we look at that and try to measure, is that thicker? Is that larger? That doesn't always occur. And so there's a lot more to it than how much cartilage you have. And I think that's implied that, what do we mean by growth? Are you going to grow a thicker layer of cartilage? That's to date, I haven't seen any convincing evidence that tells me that we can guarantee regrowth of cartilage, and that's a tough thing to do. However, maintenance of the cartilage that you do have, that is a big deal. And this is where I think that you make a big distinction between the way orthopedics look at this situation and basically how frivolously the term bone on bone gets thrown around. Because if you believe that you have bone on bone, I kind of do this with patients just as a, just kind of as an interesting discussion. I say, well, they come in and they tell me, well, doc, I don't think that your Regenexx procedure is going to work for me because I have bone on bone, and I was just wanting to check and see if maybe there's a last ditch effort for me, and maybe I could actually get, some benefit. And I say, well, now wait a second. So you have bone on bone? And they say, yeah, don't have any cartilage left. And I say, well, you want to bet? Because I can show it to you today. And to date, I've never found a patient that I cannot find cartilage still to some degree in their joint. So this concept that all the cartilage is gone is just false. We see cartilage all the time. So the question is, can we preserve it? Is there enough to be functional for you down the road? And if we help the bone and support the bone, can you maintain that cartilage? That's where we really do most of our good for patients. So we hesitate to say that, we're going to regrow cartilage, but very often it's a question of maintenance, not necessarily regrowth. And so I want to make that distinction. So, all right. So let's see here. You can see that much from an ultrasound. Would I still need an MRI? All right. So the really question centers around, do you still need an MRI if you've had an ultrasound? And the question is absolutely yes, because there are limitations. They're not a replacement for each other by any means, because there are things that you simply cannot see with an MRI that you can see with an ultrasound. And the reverse is true. There's things that, when we start talking about the quality of bone and we start looking at bone marrow lesions, which are areas of essentially edematous bone that's kind of angry and beaten up, and that starts to basically have a certain type of a signal on the MRI, and it shows up as white on one of the types of MRIs that we picture, the images that we look at. That actually gives us a really good indication and matches up very well with patients that are having pain. And so we treat those areas of the bone because very often they're weakened and damaged, and we can actually improve those. And we do see bone marrow lesions improve and disappear post-treatment. And so MRI is a critical step, and we would never want to skip that for a patient that's having, if we're contemplating, the big picture. And sometimes patients just say, well, I don't want it. I just want to do intra-articular PRP, or they have a reason why they may not want to do that. We'd always recommend it, but sometimes not completely necessary to do, let's say, a PRP. But if you said, hey, Doc, I want you to do everything you can for me, consider the bone, all of those things, then we would typically have you go ahead and get an MRI. Okay. All right. So here we're basically we're going to go ahead and wind down here this evening, and I'm going to go ahead and get you guys the phone number in case you were waiting for that part, so you could go ahead and schedule your evaluation. And I just want to thank all of you here for attending, showing up, and there were some really good questions this evening. And we'll do some more online education. We're really working to dedicate ourselves to helping patients understand more about their conditions, what the options are, and we're here if you need us. And although we were really focused on knees tonight, it's important to remember that we do spine, including neck, as well as lumbar routinely for patients, as well as shoulders, hips, foot and ankle, carpal tunnel. So we have a lot to offer, and but we are planning on having more webinars to educate you in the future about what we can do. And we're going to basically wind down. And if you guys have further questions that I didn't get to, I apologize. Go ahead and email those to Amanda, who will be in touch with you after by email. And you can send those, and I'll be happy to personally interact with you and answer your questions or get you scheduled. And remember, bring that MRI disc with you, any information that you have, because we want to really go over all of it, and you'll get your own personalized education session about what's going on with your knee. and I look forward to meeting you hopefully. And for those of you that I already know, thank you for tuning in, and good night, and until next time.